Welcome to Trial and Medical Error, where we bridge the gap between medicine and law and unlock groundbreaking trial techniques. Join hosts Brendan Lupetin and Greg Unatin as they share novel insights and strategies to help you confidently tackle the most complicated cases.
Hello, welcome to episode 1 of the Trial and Medical Error podcast. My name is Brendan Lupetin, and I'm here with my partner,
Greg Unatin.
And we are the owners of a law firm called Lupetin and Unatin, and are trying our best to put a podcast together because we love the work that we do and think there are great stories and a lot of learning lessons from the cases that we work on and try. So the podcast is mostly going to be about our experiences working up and trying a lot of medical malpractice cases or personal injury cases. And it's episode 1, and we're going to see where this goes, one episode at a time. And today we're going to kick off the podcast by talking about a recent trial that Greg and I tried together in December of 22. So about 6 months ago. We're going to probably make it it's a 2-part series, talk about how the case came together, how Greg worked it up, and then I got involved, and then how the trial went and the takeaways and learning lessons that we got from it that hopefully you, the listener, might be able to draw some value from. So with no further ado, Greg, why don't you tell us about the Corsetti versus Trombola trial? How did it come into the office, and how did you work it up? What's the case about generally?
All right. Well, thanks. Yeah, the case came in to the office. It was actually through a networking group that I was in for a short period of time. BNI, do you remember that? When I used to take off on Thursdays for lunch over at Bill's down the road. But it came in through somebody in that organization who knew through the organization Bob Corsetti. Bob is a chiropractor, also kind of a wellness guru. And Bob and I hit it off. He was very friendly, invited me to lunch one time a couple years ago, and formed a nice little relationship. So regrettably, Bob's wife, Kathy, was involved in a motor vehicle accident, a rear ender, on December 30th of 2019. And so that's why Bob gave me a call, and we had the case come into the firm. When he called me, it was really only about 2 months, I want to say, into the course of her injury after the accident. And at that point, I mean, he certainly was representing that Kathy was off. Couldn't really describe what was wrong with her necessarily beyond saying that he believed she had a concussion. And as you would expect, because Dr. Bob, as he's known, is a chiropractor, he was doing the lead. He was taking the lead on the care of Kathy. There was a chiropractor involved who wasn't Bob. He was wise enough to realize that in this context of a car accident and potential litigation, you probably shouldn't be treating your own wife. And so Bob rightly referred Kathy to an associate or a friend who started providing her that chiropractic care really right off the bat. And it was just at that point, the case seemed to be, from my perspective, not so much what it ended up being, like a concussion case, plus more to it than just that in terms of the brain. But it was a soft tissue case. Okay, we had some decent impact. The accident happened in Monroeville, PA. Kathy was nearing a stoplight and practically stopped when she was rear-ended by another driver at a relatively high rate of speed who was swerving in and out of traffic. Granted, this was a pretty bad area. I think you've been there, Brendan,
Sure.
Right? I mean, you have to merge onto whatever that highway is called that goes through Monroeville. And there's just not a lot of time to stop before you have to get to that stoplight. They were really stuck on the fact that the other driver, after he pulled his vehicle off the road, slammed into Kathy a second time. Rear-ended her a second time after she was already out of the car, granted. But that was something that really stuck with them, just to kind of demonstrate how off this driver was. And sadly, he was older, and I don't know if he had any health issues, because as we'll talk about, this was a stipulated liability case, and we never had a chance to depose the defendant in this case. So that's how it happened.
Well, let me
Kathy was
jump in there
rear-ended.
for a second, Greg.
Yeah.
So, I think all of us go through that, feeling a case comes in and, given the kind of, the size, the value, the consequential nature of the cases we try to focus on here. What was your first impression on the size and extent of this case? Did you think it was a big case or not so much?
No, not so much. I mean, I had a chiropractor calling me about an injury to his wife, who he had been treating for many, many years as a chiropractor. And I just didn't think it was really going to go too far. I thought it would be a chiropractic case, and that's about it. And it would tend to be limited in terms of
And
damages.
the truth of it is that so she gets, whacked from behind and doesn't get any medical care. Like doesn't go to the hospital that evening, doesn't go to the hospital the next day. If I remember correctly, Greg, she didn't get any formal medical treatment for a month after the crash, right?
Well, she did. She had, well, you're right, not formal, but Dr. Bob would argue with you on that point. She did get chiropractic care and she had some x-rays. And, the x-rays didn't really show anything other than some pre-existing arthritis in her spine, but nothing major.
Right. And I don't mean to
Yeah.
make light of it. And obviously we love Bob and Kathy, but that's not an easy case. A case of an older woman, even though Kathy, was living the life of a woman many, many years younger than her. Nevertheless, she was in her 70s, gets hit from behind, and doesn't get any medical care other than her husband, who happens to be a chiropractor, providing her some sort of off the books care for a month. That's kind of a tall order as far as damages. And what I was getting at is I feel like in our office, I didn't even hear about this case for a long time. I never heard the name of it. I feel like you never really told me much about it.
Well, didn't I tell you when the big turning point when Bob prescribed the hyperbaric chamber?
Yes,
Remember
this is
that?
right.
So,
Yeah, that perked my ears up. But so they get the case in, you kind of understand you're 2 months in, and she gets hit from behind, and she has these, at least at that time, kind of vague concussion type symptoms at that point, right? So
right.
what do
She
you do
does.
to work
Yeah.
the case up? I mean, do you jump right into filing suit, or did you try some pre-suit, or what happened?
I believe I did try pre-suit because that tends to be, for better or worse, my MO. So I think we did try that for a little while, but then it became apparent as Kathy's concussion workup and treatment went along that this was a much more severe, significant injury, and regardless of what I valued the case at that point, relatively early on, the Corsettis had much higher expectations. So at that point, we did file
And I
suit.
think justifiably so, as we learned later. I think that's kind of the trap sometimes that as attorneys we all fall into is you sort of categorize cases sometimes right or wrong. You put them in their buckets and, oh, this is a, smaller soft tissue head injury, maybe a concussion type case. And it's not until you really understand what they were going through, because obviously we learned later what Bob, in particular Kathy, was experiencing and how it was really impacting her life. And sometimes, we've got other cases we're working on, we're trying to run a business. And sometimes initially can't fully understand what's happening to these people, what's going through them, how this is impacting them. We learned about it later, but at the time, I think understandably, it seemed like a small case. Let me ask you this. Did the insurance company early try to make any offers to settle it on the cheap early on?
No, they didn't. But what's interesting about this case is that initially we thought that we were dealing with a much lower policy limit than it turned out to be. We thought the policy limit was $100,000. And as Kathy started to get a little bit deeper into treatment, it seemed at least apparent to me that we'd be able to approach that. And Kathy was, okay, somewhat accepting of the fact that maybe that was as much as we would be able to recover, something close to the policy limits. But then, as we got a little bit deeper, and eventually this case was scheduled for trial in early 2021, I think it was supposed to be, or actually early 2022. As we got deeper and deeper into the case, it appeared that there was more coverage. We were informed by the attorney for the insurance company or the defendant that they had 3 times as much coverage. as was initially revealed to
And
us.
was that because of
So
stacking or a different policy that hadn't attached, or what happened?
it was simply poor communication. Yeah, it was a mistake on their end.
Quotes, poor communication. But nevertheless, we did find out that there was a lot more coverage. And it turned out to be what, 1,000,000 of coverage there was?
No, there was 300,000,
Okay.
but we ended up getting the full thing. Yeah.
Okay. All right. Gotcha. To set the scene a little bit further. So the first formal treatment that Kathy gets after this crash, she gets rear-ended, and it was a legitimate impact. I mean, the other vehicle had a lot of damage. Hers had, visible property damage. I mean, it wasn't destroyed. She was able to drive her car home, right, that evening?
She
Yeah.
did. Yeah.
So
Mhm.
the first, again, I keep saying formal, just not being treated by her husband at home. Medical care, she goes to the emergency room like a month later, and they diagnose her with post-concussive syndrome, right?
Right.
And who does she, or what's the next, level of treatment that she rolls into at that point?
So Kathy was referred by the emergency department to the UPMC Concussion Center, which is an area where a lot of people who are involved in accidents and have concussions are treated. And so she started seeing one of their concussion specialists, Alicia Puskar, who is a neuropsychologist by training, but specializes in concussion
And I
treatment.
think the thing to point out with the neuropsychologists, and Dr. Puskar was phenomenal, and
Hmm.
we're very fond of her as a treater for other patients. If we see one of our patients treating with her, we know they're getting great care. In these head injury cases, however, there's some concern sometimes of when your client is only being treated by a neuropsychologist, because a neuropsychologist is a PhD, typically not an MD or a DO, right?
That's right. Yeah.
And my take from these concussion cases and why they can be so difficult is the diagnosis of a concussion or post concussion is essentially subjective, right? I mean, it's based off of the kind of the reported symptoms, or how the patient scores on, again, somewhat arguably subjective testing, as opposed to objective testing like, blood tests or radiology that could show a specific injury to the brain, that type of thing, right?
Yeah, that's absolutely right. And I mean, there is some testing that is performed, quite a bit of testing actually, in a clinic like the UPMC Concussion Clinic. But a lot of it is, without the benefit of a valid baseline, right? Because the type of tests they're doing, cognitive testing and these inventories, there's many different questions, and these types of questions have not been asked. So what they're doing is they're going off of a baseline for a normal up to 50-year-old. And I think some of these tests, as you'll remember, because you got into this with the defense neuropsychologist, some of these tests are based on a study population that only goes up to a certain age, right? And here we had a 78-year-old woman who was undergoing tests that were designed for somebody who's no older than 55 years old. So, yes, to answer your question, there's a lot of subjectivity involved. And I think often in these, as I learned in this case, neuropsychologists have to depend on patterns. And there are certain clinical profiles for different concussions. Some follow one pathway, others follow another pathway. One may be about memory, one may be about headaches, one may be about balance and dizziness issues. So it was all very interesting to learn more about, because I had not had this degree of experience in a concussion case before.
So take us through. So she now gets in treating with Dr. Puskar, the neuropsychologist. Do you remember what kind of treatment or therapy that Dr. Puskar was putting Kathy through for that, say, first year or so?
I do, yeah. So this was an important, I thought, relatively important part of our case. Kathy was referred to a physical therapist who also did vestibular therapy, named Michael Rakuto. And Mr. Rakuto is an excellent therapist, very well trained. He's with a group called Physical Therapy Now, and he did the vestibular therapy for Kathy. Really, just very intensive. She, during the course of about a year and a half, she had about 150 sessions, and they would involve a lot of different exercises designed to help her achieve balance again, because that was, as we'll learn, is was the primary issue, continues to be the primary issue, unfortunately, for Kathy.
So it didn't end there though for her. She's responding and kind of telling us how her symptoms are improving. Some things are getting better, but some things are not going away. Arguably new symptoms are developing. Where does Dr. Puskar, and the physical therapist take her? Like, what's her treatment journey?
So, right. Kathy did much better with vestibular therapy into the course of, I believe it was the beginning of 2021. By May of 2021, Kathy was doing much better, but she wasn't 100%. Okay. And as of her most recent appointment, as of that time with Dr. Puskar, she continued to have some balance issues, which just wouldn't go away. They were persistent. And so Dr. Puskar believed there might be something else going on here, perhaps some sort of a vestibulopathy, an inner ear disorder. And as it turns out, she was right. And Dr. Puskar had referred Kathy to a neuro-otologist, basically a neurologist and an ENT packed into one, named Joseph Furman in early 2021.
And tell us about what I thought was really cool diagnostic testing that Dr. Furman used to reach the diagnosis and figure out, the sort of secondary and very significant injury that Kathy was actually suffering from all this time.
So Dr. Furman is world renowned. I mean, that first and foremost needs to be said. So we were really lucky to have him as a treating physician. And he has a balance disorder clinic at UPMC where they have all the bells and whistles in terms of testing. The testing involves primarily video nystography. Infrared glasses are placed on a patient, and they're goggles, really. And they measure the patient's eye movements and actually put forth data that is interpreted and generates graphs through a computer as the patient is put in different positions. So they have these infrared goggles on, and the technologist or maybe even the doctor has the patient in a room, and they will put them in different positions. They'll lower their head down with their head to the right, their body and their head. They'll lower their head and their bed and their body down with their head to the right, and then they'll put their body on the side. So a lot of different variations, and that's what Dr. Furman used to try to determine whether she had an abnormality of her inner ear. And as it turns out, Kathy did.
And let me just interject here. So, Greg, one of the, I think, recurring themes that I'll come back to in the podcast and in different cases, different discussions of outcomes that we've helped our clients achieve is the hidden luck factor. And in this case, I mean, there are so many different places you can point to, good fortune in a sense. Obviously it was a bad thing that happened to Mrs. Corsetti, but a lot of good things happened to allow us to help her get the verdict that we did. One of them is she had really good treaters. And I think that had she wound up with a lesser neuropsychologist or a lesser vestibular physical therapist, she may never have wound up over with this world-class neuro-otolaryngologist, Dr. Furman, who, and if that had not happened, she would not have been diagnosed with that inner ear injury. And that was significant for two reasons. One, she can begin to actually get the treatment that she needs for that injury, because otherwise it just wasn't going to be treated properly. And number two, it was huge for the case because, again, one of the really difficult aspects of proving these closed head injury, mild traumatic brain injury, whatever you want to call them type cases, is the sort of invisible nature of the injury. And jurors understandably are skeptical. They are always questioning. And when you're the one coming to court asking for money for your injuries, you've got the burden to prove your case. And people jurors are rightfully skeptical about the claims that are made. And that makes it difficult with concussion cases. The jury has to rely a lot on the truth of what's being told by the plaintiff, what's being told by their friends and lay witnesses that are very important parts proving these cases. But the really good luck here from a trial perspective, I think, was that Dr. Furman with this video nystagmography that shows a legitimate computer output that a jury can see there are differences. And he can say, no, there is a definitive difference between her right ear and her left ear. That is objective evidence. And that is not something that just would coincidentally happen. Of course, the defense is going to argue that it was just coincidental and it was unrelated. But for purposes of proving that a real injury happened to this woman from this crash in the setting of somebody that didn't get any formal medical care for the first month after the crash, that's a critical piece of what helped us prove this case. So
Yeah, that's
yeah.
right.
So tell us, so now she's with Dr. Furman, and did that change her treatment, Kudo, at all, or what did that do as far as helping Kathy try to recover to some extent?
Well, it pretty much kept her on the same path. It did. There were some medications that Dr. Furman was able to offer, but it actually, he wanted her to continue vestibular therapy, really, is what he wanted. But beyond that, there wasn't that much else that she should be doing at the time. I do want to add to what you said, though, because during the workup of this case, you know, obviously we didn't have Dr. Furman in the case until the beginning of 2021. I believe his initial appointment and testing of Kathy was in April. So we have basically all of 2020 where, if we go back to our frame of mind and why you didn't know about this case, it's because we didn't have this powerful, testimony or this powerful evaluation of this testing. And even then, I got to tell you, there was a missing record. And Dr. Furman's office had not produced the output from this video nystography, the actual graphs that are created through this testing. And it wasn't until I was preparing Dr. Furman for his testimony that he asked, well, where are the graphs? Where's the data? And I said, well, I don't know. All I have is this 2-page report from you. And so up until that time, I was trying to go off of the template that I had read about and heard about through webinars from other attorneys who are handling these very successful concussion cases. And that template always seemed to involve some sort of positive abnormality on an MRI of the brain, whether it was a T2 hyperintensity or a series of them on a contrast MRI or a DTI, diffusion tensor imaging type of situation. And I really thought we were sunk without that. But fortunately, not only did we have Dr. Furman's testimony to provide the objective evidence through his testing, but we actually had something the jury could see, which we all know is critically important, right? And not just his words, but something they could see in the form of these graphs that fortunately Dr. Furman found right before trial. So, it's like you said, luck has a lot to do with it. But now I feel like we have to create our own luck whenever we have another concussion case in the firm. We have one right now where I'm thinking top of mind, we got to get this person in the hands of a doctor like Dr. Furman. And there is one who is with another health system in town here, but a doctor like that who could do the testing that he did to provide that objective evidence we
I
need.
think it's interesting too that, at least if I'm being honest and I look back on it, even as the attorney representing somebody that was injured, but you can't get inside of Kathy. And, we were not living with her day to day like, Bob was. And, I think we have to have a healthy dose of skepticism. We obviously, zealously advocate for our clients and support them. But, look, there have been times over the course of my career when I came to find out that my client was not telling things to me straight, or their symptoms legitimately did not match up with the medical findings and so forth. And I think getting that information when you asked me to get involved in the case, and I'm looking at this case and how are we going to prove this case and how are we going to demonstrate that this woman was legitimately and significantly injured from this crash, having objective information, medical objective proof that she suffered a real injury helped me, helped me really believe in the case. Because I think had you brought me into the case and we don't have the that video nystagmography proof. I'm going to say, look, we're going to do the best we can. We're going to polarize the case. We're going to get great lay witnesses to try to prove it and so forth. And I suspect we likely would have still won because Kathy had such a great story to tell. However, it's going to be there's going to be more jurors that are going to be skeptical in there. And in turn, if there's more skeptical jurors, I think even though that's more from a causation component, that's going to drag down the verdict if you don't have that objective evidence. And maybe in some cases you don't win because they don't buy it for some reason. Or that could certainly be the case in a lot. So I think we had a highly credible and impressive woman that would likely have carried the day without Dr. Furman's testing. But I still think that, when people come and talk to us about, getting a good verdict in a closed head injury case, if I'm looking at these cases in the future and I'm talking to the people, I'm saying, try your best to find something objective out there to prove there was something that the jury can see and feel.
So I want to throw a question out to you, Brendan. So when you first got involved in this case, it was relatively close to the time of trial. And I had at that point formed my own impression of the clients, right? We had been together in this case for a long time and we had a lot of talks about money. And I felt like I may have been a little bit jaded, but tell me, what was your first impression of our clients when you met?
It took a little bit. So I think the backstory was that understandably, you saw the case as a little bit more valuable than what was going to be offered, which I think at the time was, maybe 50, 60, $70,000. But, you're not seeing this as, a many hundreds of thousands value type case. And the clients, they're the ones living through this. They believed in the case. They believed that this was a really significant injury. It meant a lot to them. And they were committed to holding out and to go to trial to, believe in a jury is going to, recognize the true impact that this has had on them. So because there was that, a little bit of a understandable difference in take on value at that time, I remember you asked me, can, you come and talk with this, family and give me your impressions and maybe you can get involved and try the case. And I'm like, of course. So I think we did a Zoom with them. And I think what really swung me as far as wanting to try that case was Kathy's background. I mean, she was is an amazing woman. I mean, she was this serial entrepreneur throughout, I think the 70s, 80s, and 90s. She was in the construction industry. She was sometimes the only woman on these construction sites. She, founded Royal Flush porta potties and these construction sign companies. And I mean, really impressive person and what she had done. And then, was talking about how she retired and then had come out of retirement to help a friend sort of market and promote and grow their dental practice. And I could just kind of see who this woman was and talking with her. I love Bob as well, but Bob wasn't injured. I mean, he was the collaterally injured because of what happened to his wife. But there was just something about talking with Kathy in that meeting. And I think sometimes it's just fresh eyes. I've been there like you have. You work the case up and you start to focus on, some of the warts or the problems of the case, and you lose sight of the big picture or other aspects of the case. And so I'm looking at it with fresh eyes. And I just remember that she seemed like a really special person, somebody that, I said, look, we should definitely go try this case. They seem to be game for it. This is important to them. A settlement at, 75,000 or $100,000 isn't going to make, much of a difference to them. I mean, they're pretty well off people. And it was more about the principle of it, that the impact that this had, what was taken from her was much more valuable to them. And I think it was symbolic that they go to trial. And I'll do a little side point too. Again, you need a lot of luck to win a trial, or get a great outcome in a verdict. But there's lots of different pieces that go into cases. And in the cases that I've tried and been successful in, I think one piece of the success formula is having a plaintiff that is not only likable and is worthy, but is willing to work hard. okay, that they're willing to do what's necessary to work on and take constructive criticism on how best to tell their story and the impact of it, which of the anecdotes and the ways they describe their injuries we think are going to be most effective that they can incorporate that. But people that are willing to do the time to practice their testimony, to understand how their testimony and the entire case fits together, that's going to make a big difference. Because on the other hand, you get, sometimes unfortunately, people that are not really wanting to work hard and they, find the preparation necessary for trial to be, onerous and unnecessary. And that is, in my opinion, oftentimes a recipe for a loss when you get people that, well, you're the lawyer, you should just do it all, and they don't want to do the work themselves. And I could tell just from her background and just in talking with Bob and Kathy that they not only had a great story to tell, but were going to work hard to do the best they could at trial. So those are the kind of people that makes it easier to go to trial with.
As always, my friend, when you came into this case, you were the turning point and you were the difference maker by the end. And I say you were the turning point because I had just this, like I said, jaded perspective on my clients, unfortunately. And I think it was in part because she was so bright and so accomplished and spoke so well. Because of those things, especially the fact that she spoke so well, I had a hard time believing the severity of her injuries, believing in it. And it's ironic because you don't need to depend, as we've always discussed. We don't want to depend on our clients to prove their injuries, right? When we put our client on the stand, it's going to be very brief. We depend on our before and after witnesses for that, our lay witnesses. And I had focused for way too long because we were always having discussions about her health and her progress and her condition and the value of the case. I had focused on the way Kathy talked about her injuries. And I thought she just spoke too well, like I said. So I think that really messed with my mind in the way I had my perspective on the case. And I didn't believe in my clients well enough. And I think the big takeaway that you should have here is if you have clients and you're having a hard time believing their story, you really need to check yourself first, right? And ask yourself, am I biased for some reason? Is it just the way our relationship has developed in terms of this case and negotiations that has made it difficult for me to believe in my clients? If that's it, and if you still have doubts, you need to bring in somebody else in your firm if you can, somebody you can rely on.
Or sometimes somebody outside of your firm. You know what I mean? But get somebody with fresh eyes. Look, I mean, we've all been there. And I think your concerns are super legitimate, though. You think about it. I mean, when I met her, she was, incredibly articulate, very well spoken. And I think because of the type of person that she was, which was that, kind of, never gives up, always pushes through things, was going to accomplish what she set her mind to. When she's speaking with us, when she's speaking with anybody, she's putting on a more of a front than what's really going on with her. But your concerns were legitimate in the sense that you have to think about what is a jury going to think about this person, and she's going to walk into court just fine. She looks like $1 million, period, and it's certainly for her age. She's very well spoken, and yeah, how can you not worry that a jury's going to say, I mean, this person's fine. They're not hurt. And they got bumped in the back, and let's give them $15,000 and call it a day type thing. So I mean I wouldn't. I think I agree with you. It's always good to check yourself and get a second take on things. And it worked out well here. I think it worked out really well that I wasn't involved in the case until the end to come in and have just kind of a sort of a different view of it. And I think that also helped. I mean, and this goes both ways. And also I think sometimes talk about your case with fellow friends and attorneys outside of it, or bring them in to co-counsel with you, because they may just bring a different view to the case. And I think one of the things, not to pat myself on the back, but that I saw was how her biggest harm, the kind of the true theme, I think what really drove the verdict was her unique injury was not so much the physical aspects of things. It wasn't so much the dizziness and the actual symptomatic injuries that she was experiencing. It was the consequence of the injury, which was her inability to keep doing that job as the marketing professional and head of marketing for this dental company. That, once you started digging into that and understanding how much love and joy and passion she took in that job. And then she couldn't do it anymore because of this, because it sapped her energy and it sapped her, ability to remain sharp and be outgoing. And, they described her as the Energizer Bunny. And then you start to think about, well, what are the things that I love to do in my life? And what if I couldn't do them? And abruptly, I'm still okay. I can live my life, but I can't do that thing that I really love, that really got me going, got me out of bed in the morning and so forth. And then you start to understand, like, man, this really was a very significant injury on this person. And again, it's unique. It was just that's the unique aspect of Kathy's injury in that case that I think I was able to kind of latch on to, or it just struck me. I just to this day, I just remember being bowled over when she tells me in that first call that she was the founder of Royal Flush porta potties or whatever the porta potty company was. I don't know why I was so fixated on porta potties, but I just,
That's definitely my favorite brand.
yeah. Forever. But I just could see that this was a really unique woman with a unique injury and way that it impacted her life. And I think to your point, Greg, about checking yourself, I think one thing, and it sounds so corny sometimes, but when you actually confront people with it, it's quite powerful. And I think is something that you need to, and I'll talk about how we weave this into our actual trial. But when you think about an injury, and, because I think we can get jaded at times, we see sometimes just horrific injuries, paralysis, burns, and, cases where people just had surgery after surgery after surgery, and then you see other types of injuries in comparison or in contrast, they don't seem as terrible. But
Mhm.
if you really force yourself to put yourself in that person's shoes, or say, what if that was to happen to me? And my evil man argument, which I'm sure we'll talk about it in other podcasts. But the gist of it is, how much money would you take if you had the choice to have that happen to you? And I think that's kind of, for me, always the question you have to apply to these cases on the way you think of the damages for your client. Okay, because if you just think about it in comparison to other cases, then you just get into these kind of, it's just not fair, it's not reasonable. Now you have to do that to some extent in settlements and so forth, but to really understand, if you're going to go to trial and you're going to get behind your person's injuries, you have to, I think of it that way. If this were to happen to me and I was given a choice of, hey, we're going to do this to you. We're going to, shake your brain up. We're going to injure your, right vestibular complex of your ear. So you have, chronic dizziness. You're not as sharp as you used to be. You're more run down. How much money would you take for that? And when you think of it in those terms, the value of the case inevitably always goes way up in your mind. So
Mhm.
just a little side thing
And
to think
on
about.
that, that's well said and great points. On that topic, there was a mediation, and can you just talk a little bit about if you're familiar? I know you are, but about how much the other side, the defense, wanted Mr. and Mrs. Corsetti to take for her life changing
Yeah,
situation.
so I got involved after the mediation, but the number never changed after that point. So it was, if I'm correct, it was $75,000, and that was it. And the adjuster was resolute, and he made a mistake, but I'll give him credit for the fact that he kept his word and never offered a penny more than that $75,000. And again, I think if you go back and you think about what I was just talking about, no way, in heck would Kathy Crissetti ever have taken $75,000 for what happened to her. And hers was a real situation. There's no comparative fault. There's no partial responsibility on her part. I mean, she's sitting there stopped at a light, minding her own business, trying to drive home from work to get home to see her husband, and she just gets crushed from behind by somebody that just wasn't paying attention. So she had no choice in the matter. And I think, again, I mean, I would say maybe she probably wouldn't even have taken what we got in the verdict for what happened to her. But at least it was somewhat fair and thought through by the jury compared to what this insurance company was just saying that they thought was fair. But again, I think there's always luck involved. And this is a perfect example that the insurance company was comparing this type of case to other types of cases where, people got hit from behind and they had a minor head injury, and they had always settled those cases for at most 75, and they just shut it down. They didn't think any further through that. They didn't think as the evidence was coming in through trial, oh boy, maybe the value of this case is higher than this, and readjust, because there is no doubt in my mind that had they come up not that much higher, that the Corsettis may have taken something that was, maybe double that, maybe 150, maybe 200. If they just got to that level, then the Corsettis might take it, because again, there were problems on the case, with the case, with the damages, with the timing of how the injuries developed, where, one could argue that you could lose or get a lesser verdict.
And I need to really hand it to Kathy and Bob, because they really felt betrayed throughout the course of this litigation by the defense insurance company. Kathy actually had a bad experience during her time as a CEO with the same insurance company, believe it or not. And it was no different in this case. She wasn't terribly surprised, but further maddened for sure by the way they had just lowballed her throughout. And as usual, you're correct. Now that my mind has been joggled a little bit more, I do remember that initially we knew there was a $300,000 policy, and Kathy wanted the full policy limits initially for, as long as we knew those to be the policy limits. But then close to the time of trial, you're right, we did realize and learn it was $1 million in coverage. So that may have actually played a little bit of a part in why there was such a low offer, because the insurance company thought we could roll the dice. We got a pretty big buffer here.
Right. Yeah. There's not going to be, in their mind, rightfully so, much risk of an excess, as opposed to if it had been 300, then we would have been able to put more pressure on them. So we didn't really have economics to put on the board, which are typically going to be the factors that the carriers are going to look at as far as whether there's a higher likelihood of an excess verdict or not. But in any case, there was $1 million, and again, that's more luck to the reason why we got to try this case, and that's what ultimately wound up happening. I remember we had that decision. The Corsettis were resolute that they were not taking anything close to 75,000. The adjuster was resolute that he was not offering more than that amount of money, and so we were absolutely heading to trial and knowing we were going to go to verdict on this case, which again is always my preference. I hate those situations where there's a lot of money or maybe a question of more money on the table, and maybe it's still going to settle, kind of thing. From Jump Street, we pretty much knew we were going to take a verdict on the case, and I think that makes preparation a lot easier. And we're getting towards, I think, the end of this episode as far as part one of the Corsetti trial, but I want to just kind of wrap up with where things happen. So in trial, there's kind of what I'll call official trial. When you're in court, there's a jury there and so forth, and then in a lot of cases, there's the trial actually begins before that with pre-recorded depositions of certain witnesses. And in this particular case, the defense had Kathy examined by a neuropsychologist of their own, quote, independently hired, named Glenn Getz. And Greg, if you can recall, what was the gist of what Getz's opinions were after having evaluated Kathy, and what he was did testify to?
So the gist of Dr. Getz's opinions, it focused a little bit really a lot about just creating a finite end to Kathy's concussion symptoms. Didn't focus at all on the vestibular component to her injuries, but he picked this point in time, which was in November of 21, when Kathy was at Target, one of her first ventures out on her own to do some shopping, because typically Bob would need to drive her all over the place. She was in Target, and as soon as the lights in Target hit her, she started feeling dizzy, but wanted to get the coffee maker that she was there to get. Found the coffee maker at the bottom shelf in the aisle, stooped down like a catcher stoops down to catch a ball, and she lost her balance and fell on her butt. And that was recorded. I mean, Kathy told Dr. Puskar that, because it did happened to aggravate her symptoms. And this was just an odd episode where she had this flare up of dizziness after a course of time where she felt like she was doing better. And Dr. Getz, the neuropsychologist for the defense, latched on to this fall, if you call it that. I wouldn't really call it a fall, but that's what the defense in these cases do. They try to find some subsequent injury, like a slip and fall, that causes some sort of new injury. So that was really quite a bit of the gist of his defense, as well as saying that all of her testing was really normal. And if I remember correctly, I think he attributed a lot of her symptoms to simply anxiety.
Right. And again, I think they made a mistake that they didn't get a neurologist of their own to counter Dr. Furman's testimony and the objective evidence that we had in the case. And I remember, going to the library where they scheduled Dr. Getz's deposition for use at trial, and taking him to task on the fact that he is not a neurologist; he is a neuropsychologist, and so he had no qualifications, and he admitted that he could not assail a single opinion of Dr. Furman, had nothing to counter any of that, and so he couldn't disagree that she had this vestibular injury and that he had to agree that if Dr. Furman said that she was having all these symptoms that were caused by an injury to her inner ear due to the crash, he couldn't disagree with that. And I think that was very damaging to their defense of trying to blunt Kathy's injuries. On the other hand, again, if we didn't have Furman, if we didn't have that objective evidence in the case, I think it's a much tougher case because even though I think we both felt that Dr. Getz's opinions, for the most part, of what he was trying to attribute some of her ongoing closed head injury issues to was pretty bogus and not supported by his own writings. We confronted him with his own articles on closed head injuries and so forth, much of which, he had written things that were fully supportive of our case. But if you take Furman out of the case and you just have Dr. Puskar versus Dr. Getz, now I think there's a lot more questions that could get raised in a juror's heads about, what was the testing that she did legitimate? Is this subjective? Is this subject to exaggeration or manipulation by Kathy to make it look like she's more injured than she was? It's a tougher case. It just is. We had a world-class neurologist who was not opposed. He was unopposed in the case, and there's no doubt that that is going to weigh in Kathy's favor for winning and getting a good verdict.
And I mean, on that point, to interrupt, but in any case, I really feel like if you have the means and the resources, and you could find a specialist out there for your specific injury, right? Of course, we didn't know in Kathy's case that she even had this injury until the specialist was consulted by Dr. Puskar. So we were fortunate, like you said. But when you know that there's a diagnosis out there and you can't necessarily rely on your treater, you should try somebody who is the world leader on this particular condition, like Dr. Furman is.
Agreed. Yeah. Why can't we get that in every
Mhm.
case?
Yeah.
So I'll just talk briefly about, cross-examining a neuropsychologist like I did with Dr. Getz in this case. So, Greg, you've tried a lot of cases with me, and you know that sometimes I get kind of riled up and can sometimes go over the top. And, probably one of my biggest issues I have to work with and I'm trying to focus on is trying to maintain my emotions, not let my emotions get out in front of where the jury most likely is, not to get, more ticked off or more angry than maybe where the jury is. And if anything, being, dialing it back so that the jury is more likely to get fed up with what they're hearing. And I'm not sort of stealing their emotional reaction to the situation. I told you recently from another trial, more recently we tried, that there's this quote that from a guy, Kevin Kelly, who was the founder of Wired Magazine, read. He said, "Whenever you have a choice between being right or being kind, be kind. No exceptions. Don't confuse kindness with weakness." And, I think that idea applies in almost all instances when you are taking adverse depositions or testimony at trial, when you're cross-examining people. It's if you're going to err on one side or the other, err on being kind to that witness, trying to imagine, what they're going through and being polite as much as you can, but also gauging the situation. And I think that with Dr. Getz, he was relatively straightforward. I mean, he conceded a lot of her injury in his report. And so when you see that, I can tell myself, okay, I don't need to go in and try to destroy this person's witness, what his opinions are. I need to make a handful of points here. Number one point was he can't disagree with Dr. Furman. And he absolutely agreed with that. And so we had to concede that what Dr. Furman was saying was essentially right. He had no reason to disagree with it. Number two, we reconfirmed and underscored his opinions that corroborated Kathy's injuries. Use his testimony to help our case to bolster our credibility of the claims being made. And then regarding the opinions that differed, that we disagreed with, reasonably and as politely as I could, although there were times I think I got a little righteously indignant with some of the testimony or opinions that he provided, but confronting him with, his own materials that were opposite of that and trying to point out aspects of his opinions that, just really weren't supported by anything other than his own personal take on things. And then, of course, again, politely pointing out that, while he is billing himself as a quote independent expert, that he's not independent. He was not appointed by the court. He was not hired by us. He was not one of Kathy's treating doctors. That he was hired and is being paid for by the defense. And you don't have to go crazy with that, okay? And I certainly have over the course of my career, and I've overdone it, and probably recently in another trial overdid it with focusing on the amount of money that this expert's being paid. You have to walk that fine line, but I think it is necessary in these situations to point it out, especially when you have a treating doctor who saw this patient before there was, really any specter or anticipation of litigation or anything like that, and that person's opinions about what's going on with this patient versus the hired witness on the other side, and just making that contrast and just making sure the jury gets it, that this person is not independent. They are being hired to give these opinions by the defense. And I think that, again, not to self-congratulate myself, but I was very happy with how that examination went of Dr. Getz in that case. I thought it was helpful to us, if anything.
Oh, it set the tone, I think. After that cross examination, I really felt emboldened and like things were going to go in the right direction. Part of the reason for that is just the contrast between your examination and the direct examination. The direct examination was very loose. I mean, it was relatively well organized, but it didn't really flow very well, in my opinion. Unfortunately for the doctor, he was a little off that day as well. He was getting ready for a vacation. He was a little under the weather too, and he even arrived late. So just again, luck comes into play. But the contrast was that your cross examination was extremely tight and well organized. And so, you got it all in. It couldn't have been much more than a 15-20 minute cross examination from what I remember. And, like you mentioned that sometimes you get a little carried away, perhaps. I've seen that, yeah, but it wasn't in this cross examination carried away. Up until the very end, there was one little question you just couldn't help yourself but asking. What was that, if you remember?
I can't remember. Remind me. Now I'm intrigued. What?
You don't remember
No.
this?
What did I
Oh,
say?
wow. The last question you were, I think, quoting from Dr. Furman's expert report, something to the effect of, in Dr. Furman's opinion, Kathy's dizziness and imbalance disorder is likely to continue for the rest of her life. Isn't that correct, doctor? He's like, yes. Is that something that you would want to live with for the rest of your life?
Hey, I love that question. I think that was a great. And he agreed, and his reaction was terrific. He was like, "No, I would not." And I thought that was so. I think personally that was a kick butt question, which I would ask again in the right circumstance. But the one other point is that Dr. Getz, again, you have to size up who your opponent is, and he is a generally very pleasant guy. He's sort of soft spoken. He's, I don't want to say sweet, but he's not a jerk. He's not aggressive. And I think that if I had been overly aggressive or, maybe just, yeah, more intense, it wouldn't have come off well. So I really had to tell myself, look, this guy, he's pretty easygoing. And so I have to be as easygoing as I can possibly be under these circumstances. And I think as best I could, I was. And I think that exam came off well and helped the case, if anything.
Well, that last question that you asked Dr. Getz, is this something that you'd want to deal with for the rest of your life? Would come back later on in the trial in another deposition recorded for use at trial. And we'll get into that, I guess, in the next episode.
Yeah. So, yeah, that'll wrap up episode number 1. Congratulations to both of us for our flagship or first podcast in the books. I am, as much as I can remember and think to do so, going to try to end our podcast with a little trial tip or trial concept that people can think about incorporating in their case. Again, I think I look at all the trial guides books and the seminars I go to and talking with different friends of ours and all the trial information that we're inundated with and other great podcasts as sort of a like a buffet. And I take the stuff that resonates with me that looks yummy to me, and I use that, and I don't take the rest. And I think, like anything, that's how we use this information. And so, the tips or suggestions that I give, use that caveat emptor, or use it if it resonates with you. But my other little piece before I get into this is, any piece of advice, any argument technique that you learn about or hear about, don't just use it blindly. Don't just throw it in there because, somebody else was doing it because Keith Mitnick said to do it, or, Brian Panish or David Ball or, Rick Friedman said this is how they did it in their transcript. You have to, if you like something, you have to think through it. You have to talk through it. You have to say it out loud and internalize it and make it your own. You have to fully understand, like, why are you saying it? What does it mean? So that you can say it in your own words, because otherwise it's just going to sound artificial and phony at least in my opinion. So the one little tip I'll give that I've started doing recently in certain cases is when I'm talking about damages in opening statement, when you're talking about pain and suffering and why is the jury having to appraise loss, okay? And you always talk about it as a loss, what was taken away, because that's much more powerful than this idea of like what they're going to get. It's not about what they're going to get, it's what was taken away. But literally in opening, a lot of times what I say now is, as you think about this, ladies and gentlemen of the jury, and you think about how much money would be fair to make up for what was taken away, think about if Mr. or Mrs. Plaintiff knew and had a choice of what was about to happen to them, being the injuries in your case. And they were normal. This was before everything happens. And they are presented with, this is your future, okay? This terrible injury, this horrible medical care, this way your life is being impacted. How much money would you take for that? Okay. And I literally am saying that in openings now as how to help the jury think about why they give money and what they're giving the money for and what the purpose of it's for. It's not, jackpot justice. It's not a lottery. Okay. It's because this person, hopefully it's not too much of a comparative fault case, but it's because this person didn't have a choice. And so if they did, imagine they did have a choice, how much money would they take? That's a way to think about voting for an amount of money for pain and suffering damages. So it feels right to me. I like it. I did it in the opening of Corsetti, and if it feels right to you, I say go ahead, use it.
It's a great way to prime their minds for awarding damages. I think it's a great tip.
Yeah. All right. Well, that wraps up episode 1. In episode 2, we will talk about the actual trial and outcome of the Corsetti case. So thanks for listening, and we'll see you in episode 2.
Thanks for tuning in to Trial and Medical Error. We hope our discussions have equipped you with actionable insights to lift your clients above the hurdles of medical malpractice litigation. Ready to refer or collaborate on MedMal and catastrophic injury cases? Visit our attorney referral page at pamedmal.com/refer. See you in the next episode.